Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us again. Going to be speaking with Dr. Abdul Abdellatif, Assistant Professor, Baylor College of Medicine, and he's joining us here to talk about some of the latest data that was presented in a study that was presented at the American Society of Nephrology 2020. Welcome to Health Professional Radio, Dr. Abdellatif.
Thank you, Neil. Thank you.
Well, give our listeners a bit of your background and then give us some insight into this PROTECT trial.
Sure. I'm a general nephrologist as well as a private nephrologist at Baylor College of Medicine, as well as a private group, Clear Lake Specialties in Houston, Texas. And the presentation we actually presented at ASN was a new data that has not been really looked into before in the transplant population, which is looking at treatment of uncontrolled gout using Krystexxa, which is Pegloticase, a medication that helps the body get rid of the uric acid. So the reason that we initiated the trial initially is to look at this vulnerable population who unfortunately has the prevalence of gout 10 to almost 12% compared to only 1% in the general population. So they're 10 to 12 times higher than the general population of developing this disease, which sometimes becomes significantly debilitating. So the medication is already actually approved by the FDA to be used in all patients with uncontrolled gout. And it's been used in patients with normal kidney function, patients with chronic kidney disease, patients on dialysis, as well as patients in transplant. However, the reason we opted to obtain a little bit more insight into specifically treating this patient population, there has only been very limited data looking at these patients from phase 2 trials. So this is phase 4 trial, means the drug is approved, but we're actually doing an intent to treat trial. Therefore, we took a cohort of 20 patients who had their kidney transplant for at least 1 year, as well as been on a stable immunosuppressive medication to prevent rejection for at least 3 months. And these patients, actually, most of them have had gout for at least 6 years, plus or minus. And most of them, actually, we recruited had transplant for about 15 years, plus or minus. And when we intended to treat these patients, our goal was to take those patients who has been refractory to the commonly known 2 drugs in the market that we use to lower the uric acid, which is allopurinol and febuxostat Uloric. And these patients basically have a lot of risk factors that predispose them to developing severe uncontrolled gout, including the actual medication that we give them to protect them from transplant rejection, predisposes them to having high uric acid, which usually precipitate gout or lead to the de novo development of gout in these patients. Not only that, but we also wanted to look at variable changes in their kidney function or from their pain and disability score. So at the time when we presented the data at ASN, we already had 5 of the 20 patients had completely finished the treatment period, which is 6 months. And the data was excellent, very promising. We saw about 80 to 90% response rate without any related complications or anaphylaxis. And why is that important? Because when we actually look at Krystexxa in the pivotal trial, looking at patients with chronic gout, the response rate initially was about 42% in these patients, because anytime you use a medication that is an infusion therapy, which is this drug, the body can recognize that medication, because usually we put molecules around it, which is called the PEG, and the immune system sometimes recognize the PEG and trying to neutralize the drug, means make it less effective and get rid of it faster from the circulation. So when you treat a patient who's already on immunosuppressive medication that's actually protecting them from rejecting the kidney, same thing, is protecting them from developing those antibodies against the drug, which allows the drug to actually work better than expected in patients who are not on these kind of medications. And exactly what we saw. So that was our anticipation, that we will see better efficacy and response rate in these patients, and we saw that.
What about the gout before they had the transplant? They had kidney function issues in the first place causing gout. They had gout before the transplant, and then it was exacerbated by the transplant?
Actually, some of these patients may not have had gout at all before transplant, and they developed what we call de novo gout. So some of them did have pre-existing gout, and the gout was basically exacerbated after transplant because of the medications, what we call cyclosporin and tacrolimus that we give to these patients. But also these patients may be on diuretics to control the blood pressure. And when we give a patient a kidney transplant, they don't have completely normal kidney function. They still have one kidney, and they're considered to have renal insufficiency. So they're still at risk for having increased uric acid. So they don't have to have pre-existing gout, but we see even new onset of gout in this patient population with time.
How early after the transplant are you seeing the gout? You said these patients had to have the transplant in for at least 1 year, correct?
Yes, true.
So early, are we talking 6 months in?
Sometimes if the patient has pre-existing gout, you may see gout exacerbation early on in the disease state. But sometimes it takes few years for a patient with untreated, uncontrolled hyperuricemia before they actually develop significant gout. Now, there's no indication to treat only elevated uric acid, which is hyperuricemia in the circulation for any condition, unless if the patient has an underlying pathology that needs to be treated, such as gout or recurrent uric acid kidney stones, or a patient with other conditions. However, if the patient is diagnosed with gout, that's the time we intervene and place the patient on those urate-lowering agents.
What would you say your future plans are pertaining to uncontrolled gout as it relates to research?
Actually, unfortunately, gout is maybe one of the diseases that is very prevalent. We have about almost 8 to 10 million adults in the United States with it, but it's underdiagnosed, undertreated. And our goal here from this trial and other trials that we are conducting is really to find a better approach and better regimen to control these patients who unfortunately become disabled if the gout is not appropriately treated for a long time, either short-term disability where they may have to, miss work or not be able to do the things they're doing, or long-term if they develop destructive arthropathy, because untreated chronic gout can lead to bone damage and joint destruction.
Well, where can our listeners go and get some more information?
Definitely, there's a lot of avenues to look for information, and especially since we have this presented at ASN, going into ASN website and looking at this new data that has been presented would be a source for most recent up-to-date data available. Gout is, like I said, very prevalent when going on the internet to look for the website on the medication itself. Like Krystexxa, there's a lot of educational material available as well.
Well, Dr. Abdellatif, I sure appreciate you joining us here on Health Professional Radio and giving us this information.
Thank you, Neil, for this opportunity.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.